I'm Dr. Brian DeVorney.
And I'm Dr. Clayton Stitzel. We understand that choosing a scoliosis treatment option can be a time of frustration and anxiety.
We hope the information contained in this video will help you to make an informed decision about Clear Institute's approach for treating scoliosis. Scoliosis is a spinal deformity affecting approximately 5 to 10% of the population. It is more prevalent in girls than in boys at approximately an 8 to 1 ratio and is generally seen at the ages of 8 to 14. Scoliosis is a three-dimensional condition involving the nervous system as well as the bones, ligaments, and muscles. When evaluating scoliosis, it is extremely important that we take into consideration all three dimensions and not merely just the lateral bending component measured generally by a Cobb's angle. We need to understand that when we're looking at scoliosis on an x-ray, that it is the symptom that we are evaluating and looking at. The nervous system is controlling the disease and creating the spinal curvature. It's very similar to looking outdoors and seeing a branch moving in the wind. We don't really see the wind, but we can see the branch moving and we can see the effects of the wind on the branch. Very similar to the nervous system creating the curvature.
Spinal twisting from the top and bottom results in a curvature located in the middle of the spine, which creates tension in the spinal cord. It's important to understand that the spine is made up of 24 individual bones called vertebrae. Now, each vertebrae has independent motion, but none of them move independently. For example, you can't wiggle one vertebrae. They move as a series of groups, and these groups are what contribute to the overall spinal curvature. It's necessary to evaluate each one of these groups to determine which ones are creating the curvature. Then we can create a customized treatment plan for every patient.
The abnormal spinal configuration involved with scoliosis has several soft tissue adaptations that must be addressed. Because the spinal configuration has deviated from a relatively symmetrical position, where ligaments and muscles, when viewed right to left, are the same length and disc pressure is fairly neutral, to a twisted and bent position, several soft tissue changes will occur.
The early stage of scoliosis development is characterized by forward head posture and hip rotation.
With scoliosis, the spine twists towards the inside of the curvature. As curves progress, the twisting gets stronger and stronger, limiting motion of the spine and decreasing breathing capacity. By using specialized equipment, we can create traction combined with derotation to effectively untwist the scoliosis, creating more spine motion and increasing breathing capacity. The loss of curves in the side view of the spine create the scoliosis curves in the front view of the spine, resulting in spinal cord tension.
In the progressive stage of scoliosis development, the spinal cord tension causes the spine to continue to twist and buckle to the side, resulting in ribcage rotation and rapid increase in curvature. The current medical model for the treatment of scoliosis is 0 to 25 degrees observation only and no treatment required. From 25 to 40 degrees, rigid bracing is recommended. Any curvatures over 40 degrees immediately are recommended for surgery.
With the Clear Alternative Treatment Model for curves 0 to 25 degrees, we recommend proactive early-stage scoliosis intervention to drastically reduce any possibility of progression, thus eliminating later stages. For curves above 25 degrees, we recommend a non-invasive neuromuscular spinal rehabilitation program to effectively reduce and stabilize larger curves without the need for bracing or surgery. A 2007 study published in Spine by Drs. Dolan and Weinstein concluded that observation only or bracing showed no clear advantage of either approach. Furthermore, one cannot recommend one approach over another to prevent surgery. They gave the recommendation for bracing a grade D relative to observation only because of troubling, inconsistent, or inconclusive studies on any level. Dr. Han Weiss, director of the Schroth Clinic in Germany, published a highly regarded article in 2008 edition of Disability and Rehabilitation. The study found no evidence has been found in terms of prospective controlled studies to support surgical intervention from the medical point of view. Until such evidence exists, there can be no medical indication for surgery. The indications for surgery are limited for cosmetic reasons in severe cases and only if the parent and family agree with this. Clear Institute provides an effective non-bracing, non-surgical treatment option which can begin at any time regardless of the size of spinal curvature. Clear's comprehensive spinal rehabilitation program addresses the nervous system as well as the soft tissue adaptations that accompany scoliosis.
The Clear Institute has developed a treatment program referred to as the Mix, Fix, and Set method. The mix is designed to relax the soft tissue which is holding the spinal curvature in place. The fix is designed to mobilize and reposition the joints. The set is designed to re-educate the brain and strengthen the muscles to hold the new straighter position. One very important aspect of successful treatment is full participation in the home rehabilitation program. It's important to note that a scoliosis traction chair may be necessary for home use on larger curvatures. Our initial treatment goals are to reduce the forward head posture, restore the normal curves to the neck and lower back, and derotate the hips. This is similar to untwisting the rubber band from the top and bottom and working our way back to the middle again. The secondary treatment goal is to undo the spinal buckling and twisting, which reduces the curvature and eliminates the progression.
A typical scoliosis evaluation will include a complete case history involving the date of initial diagnosis, any documented progression of the spinal curvature, as well as any past evaluation and treatment that has been rendered up to this point. We will also discuss and review any treatment options that you may be currently considering. A certified Clear doctor will perform a standardized physical exam and take x-rays. Although full spine x-rays may be used, they are not accurate enough to properly evaluate scoliosis biomechanics. To precisely determine how each of the spinal units is involved in producing the larger Cobb angles, individual sections of the spine will be x-rayed. The x-rays necessary to evaluate scoliosis require only a very low amount of exposure. In fact, all the necessary views are the equivalent to one standard full spine x-ray. In 2000, the Journal of Pediatric Orthopedics stated that a lifetime's exposure to scoliosis x-rays resulted in a less than 1% increase in cancer or genetic birth defect, and furthermore describes the risk as minimal.
We hope this information has helped you decide to seek a non-bracing, non-surgical treatment alternative for scoliosis with a certified Clear Institute doctor. At Clear Institute, we're changing lives, one spine at a time.